Question 1. A 50-year-old male with a history of hypertension, obesity, and a moon face presents to the clinic. He reports recent weight gain, muscle weakness, and easy bruising. His lab results show elevated cortisol levels. Which of the following is the most likely diagnosis? A. Hyperthyroidism. B. Addison's disease. C. Cushing syndrome. D. Acromegaly. Answer: C. Cushing syndrome. Rationale: Cushing syndrome is characterized by elevated cortisol levels, often leading to symptoms such as moon face, weight gain, muscle weakness, and easy bruising. Hyperthyroidism causes weight loss and tachycardia. Addison's disease presents with weight loss and fatigue, and acromegaly involves abnormal growth rather than cortisol elevation. Question 2. A patient with diabetes mellitus is being treated with insulin. The nurse notices that the patient is exhibiting signs of hypoglycemia, including confusion, sweating, and shaking. The patient's blood glucose level is 58 milligrams per deciliter. Which of the following is the nurse's priority action? A. Administer 15 to 20 grams of fast-acting carbohydrates. B. Administer insulin to correct hyperglycemia. C. Provide the patient with a glass of water. D. Monitor the patient's vital signs every 5 minutes. Answer: A. Administer 15 to 20 grams of fast-acting carbohydrates. Rationale: The immediate treatment for hypoglycemia is to provide fast-acting carbohydrates like glucose or fruit juice to quickly raise the blood sugar level. Insulin would worsen hypoglycemia. Water does not address glucose levels, and monitoring vital signs is secondary to treating hypoglycemia. Question 3. A 60-year-old female presents with symptoms of fatigue, cold intolerance, constipation, and weight gain. Her laboratory results reveal an elevated TSH level and low T3 and T4. What is the most likely diagnosis? A. Graves' disease. B. Hypothyroidism. C. Hyperparathyroidism. D. Cushing's disease. Answer: B. Hypothyroidism. Rationale: Hypothyroidism is characterized by elevated TSH levels and low T3 and T4. Symptoms like fatigue, cold intolerance, constipation, and weight gain are classic signs. Graves' disease causes hyperthyroidism with symptoms like weight loss and heat intolerance. Hyperparathyroidism presents with hypercalcemia, and Cushing's disease would have elevated cortisol. Question 4. A nurse is caring for a patient post-thyroidectomy for thyroid cancer. The patient develops symptoms of hypercalcemia, including confusion, weakness, and nausea. Which lab value is most important for the nurse to assess to confirm the suspected complication? A. TSH levels. B. Parathyroid hormone PTH levels. C. T3 and T4 levels. D. Cortisol levels. Answer: B. Parathyroid hormone PTH levels. Rationale: After a thyroidectomy, damage to the parathyroid glands can lead to hypoparathyroidism, causing low calcium levels. If calcium levels rise post-operatively, it could suggest parathyroid hyperfunction or an issue with calcium regulation. TSH, T3, and T4 and cortisol levels are not directly related to calcium balance. Question 5. A 28-year-old woman presents with a history of polyuria, polydipsia, and a family history of type 1 diabetes. Her fasting blood glucose level is 170 milligrams per deciliter. What is the most appropriate initial intervention? A. Begin insulin therapy and provide education on lifestyle modifications. B. Initiate oral hypoglycemic agents and refer for diabetes education. C. Recommend dietary changes and monitor blood glucose in 1 week. D. Refer for immediate diabetic ketoacidosis treatment. Answer: A. Begin insulin therapy and provide education on lifestyle modifications. Rationale: The patient's presentation, including polyuria, polydipsia, and elevated blood glucose levels, is indicative of type 1 diabetes, which requires insulin therapy. Oral hypoglycemic agents are for type 2 diabetes. Dietary changes alone are insufficient for treatment, and diabetic ketoacidosis is not yet present. Question 6. A patient with a history of diabetes mellitus is admitted to the hospital with a blood glucose level of 300 milligrams per deciliter and a pH of 7.35. The nurse suspects diabetic ketoacidosis, DKA. Which of the following lab findings would most likely confirm DKA? A. Low blood glucose and low bicarbonate levels. B. Elevated blood glucose and decreased bicarbonate levels. C. Low blood glucose and normal bicarbonate levels. D. Elevated blood glucose and elevated bicarbonate levels. Answer. B. Elevated blood glucose and decreased bicarbonate levels. Rationale. In DKA, there is hyperglycemia, typically greater than 250 milligrams per deciliter, along with metabolic acidosis, reflected by low bicarbonate levels, typically less than 15 milliequivalent per liter. Low glucose and low bicarbonate would suggest another condition, and high bicarbonate would not be consistent with DKA. Question 7. A nurse is caring for a 45-year-old male patient with a recent diagnosis of primary hyperparathyroidism. The patient's lab results show elevated calcium levels and low phosphate levels. What is the most appropriate nursing intervention? A. Administer a calcium-lowering medication as ordered. B. Encourage a high-calcium diet to promote bone health. C. Prepare the patient for parathyroid surgery. D. Educate the patient about increasing fluid intake. Answer. C. Prepare the patient for parathyroid surgery. Rationale. Primary hyperparathyroidism often requires surgery to remove the overactive parathyroid glands. Administering calcium-lowering medication is not a standard treatment for this condition, and a high-calcium diet could worsen symptoms. Fluid intake helps manage symptoms, but surgery is the most definitive treatment. Question 8. A patient presents with a sudden onset of severe fatigue, nausea, vomiting, and hypotension. The nurse notes the patient has a history of Addison's disease. What is the most likely cause of these symptoms? A. Acute adrenal crisis. B. Acute myocardial infarction. C. Hyperthyroid storm. D. Diabetic ketoacidosis. Answer. A. Acute adrenal crisis. Rationale. Addison's disease can lead to an adrenal crisis, which is a medical emergency characterized by fatigue, hypotension, and electrolyte imbalances. MI, hyperthyroid storm, and DKA are not typically associated with Addison's disease. Question 9. A 32-year-old woman with hypothyroidism is being treated with levothyroxine. She presents with symptoms of palpitations, weight loss, and irritability. Her TSH levels are low, and T3 and T4 levels are high. What should the nurse suspect? A. Overdose of levothyroxine. B. Underactive thyroid function. C. Hyperparathyroidism. D. Acute thyroiditis. Answer. A. Overdose of levothyroxine. Rationale. Symptoms of palpitations, weight loss, and irritability, along with low TSH and high T3 and T4 levels, suggest that the patient is experiencing an overdose of levothyroxine, which can cause hyperthyroid-like symptoms. Underactive thyroid function would present with elevated TSH and low T3 and T4. Question 10. A nurse is reviewing the results of a 24-hour urine collection for a patient with suspected pheochromocytoma. Which of the following findings would most likely support the diagnosis? A. Elevated catecholamines and vanillomandelic acid VMA. B. Low catecholamines and elevated VMA. C. Elevated cortisol levels. D. Low glucose levels and elevated potassium. Answer. A. Elevated catecholamines and vanillomandelic acid VMA. Rationale. Pheochromocytoma is a tumor of the adrenal medulla that produces excess catecholamines, leading to elevated levels of catecholamines and their metabolites, such as vanillomandelic acid VMA. Elevated cortisol is more relevant to Cushing syndrome, and the other findings are not consistent with pheochromocytoma. Question 11. A 45-year-old woman presents with symptoms of persistent fatigue, hair loss, and dry skin. Her TSH levels are significantly elevated, and her T3 and T4 levels are low. Which of the following is the most appropriate treatment for this patient? A. Thyroid hormone replacement therapy. B. Surgical resection of the thyroid. C. Antithyroid medications. D. Radioactive iodine therapy. Answer: A. Thyroid hormone replacement therapy. Rationale: this patient's symptoms and lab findings are consistent with hypothyroidism, which is treated with thyroid hormone replacement, levothyroxine. Surgical resection and radioactive iodine therapy are used for hyperthyroidism, and antithyroid medications treat overactive thyroid function, not hypothyroidism. Question 12. A 65-year-old male with a history of type 2 diabetes presents with an ulcer on his foot that has not healed for several weeks. His blood glucose levels are poorly controlled. Which of the following is the nurse's priority intervention? A. Apply a topical antibiotic to the ulcer. B. Increase the patient's insulin dosage. C. Assess the patient's foot for signs of infection and ischemia. D. Recommend a high-protein diet to promote wound healing. Answer: C. Assess the patient's foot for signs of infection and ischemia. Rationale: the priority intervention is to assess for infection and poor blood flow ischemia in the foot, as these can worsen healing and lead to complications. While antibiotics and insulin adjustments may be needed, a proper assessment is the first step in care. A high-protein diet can aid healing, but isn't the immediate priority. Question 13. A 28-year-old male with a history of obesity and polycystic ovary syndrome, PCOS, presents with irregular menses and infertility. His serum testosterone levels are elevated. Which of the following is the most appropriate treatment for this patient? A. Metformin. B. Oral contraceptive pills. C. Insulin therapy. D. Thyroid hormone replacement. Answer: B. Oral contraceptive pills. Rationale: oral contraceptive pills are commonly prescribed to manage irregular menses and elevated testosterone levels in patients with PCOS. Metformin is used to treat insulin resistance, and insulin therapy is not appropriate for PCOS alone. Thyroid hormone replacement is used for hypothyroidism, not PCOS. Question 14. A patient with a diagnosis of hyperthyroidism is being treated with methimazole. The nurse should monitor for which of the following serious side effects of this medication? A. Hypoglycemia. B. Agranulocytosis. C. Hypercalcemia. D. Hypertension. Answer: B. Agranulocytosis. Rationale: methimazole, an antithyroid medication, can cause agranulocytosis, a life-threatening reduction in white blood cells. The nurse should monitor for signs of infection, as this condition increases the risk of infections. Hypoglycemia, hypercalcemia, and hypertension are not commonly associated with methimazole. Question 15. A 70-year-old male with long-standing uncontrolled diabetes presents with a blood glucose level of 500 milligrams per deciliter and deep, rapid breathing. His lab results show a low pH, and his urine is positive for ketones. What is the most likely diagnosis? A. Diabetic ketoacidosis, DKA. B. Hyperosmolar hyperglycemic state, HHS. C. Thyroid storm. D. Addisonian crisis. Answer: A. Diabetic ketoacidosis, DKA. Rationale: DKA is commonly seen in type 1 diabetes, characterized by hyperglycemia, ketosis, metabolic acidosis, low pH, and rapid breathing, Kussmaul respiration. HHS can present similarly, but without ketosis. Thyroid storm and Addisonian crisis involve different pathophysiology and are less likely in this scenario. Question 16. A 42-year-old female presents with a history of irregular periods, acne, and excessive hair growth. She also reports difficulty losing weight. Her serum androgen levels are elevated. Which of the following is the most appropriate first-line treatment? A. Oral contraceptives. B. Insulin sensitizers, metformin. C. Corticosteroids. D. Antiandrogens, spironolactone. Answer: A. Oral contraceptives. Rationale: oral contraceptives are often the first-line treatment for managing elevated androgens in women with McQs, as they help regulate menstrual cycles and reduce symptoms like acne and excessive hair growth. Metformin is used for insulin resistance in McQs, but oral contraceptives are more commonly used as initial therapy. Question 17. A 60-year-old woman with a history of osteoporosis presents with back pain after a minor fall. A bone density scan shows a significant reduction in bone mineral density. Which of the following is the most appropriate intervention? A. Vitamin D supplementation alone. B. Bisphosphonate therapy. C. Physical therapy to strengthen muscles. D. Hormone replacement therapy. Answer: B. Bisphosphonate therapy. Rationale: bisphosphonates are the first-line treatment for osteoporosis, as they help prevent bone resorption and fractures. Vitamin D supplementation is important for bone health, but is not sufficient alone to treat osteoporosis. Physical therapy and hormone replacement therapy are adjuncts but not first-line treatments. Question 18. A patient with a history of primary hyperparathyroidism is being evaluated for surgery. The nurse should educate the patient on which of the following potential complications post-surgery? A. Hypocalcemia. B. Hypercalcemia. C. Hyperkalemia. D. Hypoglycemia. Answer: A. Hypocalcemia. Rationale: after parathyroidectomy for primary hyperparathyroidism, there is a risk of hypocalcemia due to the sudden decrease in parathyroid hormone levels. Hypercalcemia is the condition being treated, and hyperkalemia and hypoglycemia are not directly related to parathyroid surgery. Question 19. A 25-year-old female with newly diagnosed hypothyroidism is prescribed levothyroxine. Which of the following instructions should the nurse include when teaching the patient about medication administration? A. Take the medication with food to increase absorption. B. Take the medication at bedtime for convenience. C. Take the medication in the morning on an empty stomach. D. Take the medication with a calcium supplement to prevent side effects. Answer: C. Take the medication in the morning on an empty stomach. Rationale: levothyroxine should be taken in the morning on an empty stomach to optimize absorption. It should not be taken with food or supplements like calcium, as these can interfere with absorption. Taking it at bedtime can also reduce its effectiveness. Question 20. A 35-year-old male with a history of chronic alcohol use is admitted with jaundice and hepatomegaly. His lab results show elevated serum cortisol levels. Which of the following conditions should the nurse suspect? A. Cushing syndrome. B. Hyperaldosteronism. C. Hepatic cirrhosis. D. Addison's disease. Answer: A. Cushing syndrome. Rationale: chronic alcohol use can lead to secondary hypercortisolism, often seen in Cushing syndrome. Elevated cortisol levels, combined with symptoms like hepatomegaly and jaundice, suggest this diagnosis. Hyperaldosteronism, hepatic cirrhosis, and Addison's disease do not typically present with these findings. Question 21. A 55-year-old male with a history of hypertension, obesity, and recent onset of type 2 diabetes presents to the clinic. His lab results show an elevated morning cortisol level. Which of the following should the nurse suspect? A. Cushing syndrome. B. Hyperthyroidism. C. Primary hyperparathyroidism. D. Hypothyroidism. Answer: A. Cushing syndrome. Rationale: Cushing syndrome is associated with elevated cortisol levels and can present with obesity, hypertension, and diabetes. Hyperthyroidism typically causes weight loss and tachycardia, and primary hyperparathyroidism presents with elevated calcium levels. Hypothyroidism would present with symptoms like weight gain, fatigue, and cold intolerance. Question 22. A 70-year-old female with osteoporosis presents to the emergency department after a fall. She is complaining of severe back pain. Her blood pressure is 110 over 70 millimeters of mercury. Heart rate is 90 BPM, and she is afebrile. A bone density scan reveals a T-score of -3.5. What is the most appropriate nursing intervention? A. Administer analgesics and monitor for fractures. B. Perform a complete neurological assessment. C. Assess for signs of a heart attack. D. Start intravenous fluids for hydration. Answer. A. Administer analgesics and monitor for fractures. Rationale. A T-score of -3.5 indicates severe osteoporosis, putting the patient at risk for fractures. Analgesics should be administered for pain management, and the nurse should monitor for fractures. There is no indication of a heart attack or fluid volume deficit, and a neurological assessment is not indicated unless there are signs of nerve damage. Question 23. A 40-year-old male with a history of hyperparathyroidism undergoes a parathyroidectomy. Which of the following should the nurse monitor for postoperatively? A. Hypoglycemia. B. Hypercalcemia. C. Hypocalcemia. D. Hyperkalemia. Answer. C. Hypocalcemia. Rationale. After a parathyroidectomy, the patient is at risk for hypocalcemia due to a sudden decrease in parathyroid hormone levels. Hypoglycemia, hypercalcemia, and hyperkalemia are not typically associated with this procedure. Question 24. A patient with a diagnosis of hyperthyroidism is being treated with radioactive iodine. Which of the following instructions should the nurse provide regarding post-treatment care? A. Increase fluid intake and avoid close contact with others for several days. B. Avoid taking antithyroid medications for 1 month post-treatment. C. Limit physical activity for 24 hours following treatment. D. Continue a high-protein diet to maintain metabolic function. Answer. A. Increase fluid intake and avoid close contact with others for several days. Rationale. After radioactive iodine treatment, the patient is instructed to drink plenty of fluids to help flush the radioactive material from the body and avoid close contact with others to minimize radiation exposure. Antithyroid medications may still be used post-treatment, and a high-protein diet is not necessary for thyroid function. Question 25. A 32-year-old female presents with irregular periods, acne, and excessive hair growth on her face and chest. Her serum testosterone level is elevated. Which of the following interventions is most appropriate to manage these symptoms? A. Metformin. B. Oral contraceptive pills. C. Insulin injections. D. Thyroid hormone replacement. Answer. B. Oral contraceptive pills. Rationale. Oral contraceptive pills are often used to regulate menstrual cycles and reduce the symptoms of elevated testosterone, such as acne and hirsutism, in women with polycystic ovary syndrome (PCOS. Metformin is used to manage insulin resistance in PCOS, but is not the first-line treatment for these symptoms. Question 26. A 50-year-old male with a history of uncontrolled diabetes presents with blurred vision and tingling in his feet. His fasting blood glucose is 300 milligrams per deciliter. Which of the following long-term complications is he most at risk for? A. Diabetic ketoacidosis, DKA. B. Diabetic nephropathy. C. Acute pancreatitis. D. Hyperosmolar hyperglycemic state, HHS. Answer. B. Diabetic nephropathy. Rationale. Chronic uncontrolled diabetes leads to complications such as diabetic nephropathy, which can cause blurred vision and neuropathy. DKA and HHS are acute complications of uncontrolled diabetes, not long-term effects. Acute pancreatitis is unrelated to diabetes in this context. Question 27. A patient with a history of Addison's disease is admitted with symptoms of weakness, hypotension, and hyperkalemia. The nurse should prepare to administer which of the following medications? A. Insulin. B. Hydrocortisone. C. Levothyroxine. D. Methimazole. Answer: B. Hydrocortisone. Rationale: in Addison's disease, the adrenal glands do not produce enough cortisol. Hydrocortisone is a corticosteroid used to replace the missing cortisol. Insulin is used to treat hyperglycemia. Levothyroxine is used for hypothyroidism, and methimazole is an antithyroid medication. Question 28. A 60-year-old woman presents with confusion, fatigue, and hyperpigmentation of her skin. Her lab results reveal low sodium, high potassium, and low cortisol levels. What is the most likely diagnosis? A. Hyperthyroidism. B. Cushing syndrome. C. Addison's disease. D. Hypoparathyroidism. Answer: C. Addison's disease. Rationale: symptoms of hyperpigmentation, low sodium, high potassium, and low cortisol levels suggest Addison's disease, a condition of adrenal insufficiency. Hyperthyroidism, Cushing syndrome, and hypoparathyroidism do not typically present with these symptoms. Question 29. A 45-year-old male with a history of hypertension and obesity is diagnosed with metabolic syndrome. Which of the following is a key characteristic of metabolic syndrome? A. Hyperkalemia. B. Abdominal obesity. C. Hypoglycemia. D. Low blood pressure. Answer: B. Abdominal obesity. Rationale: abdominal obesity is a hallmark of metabolic syndrome, which also includes hypertension, hyperglycemia, and dyslipidemia. Hyperkalemia, hypoglycemia, and low blood pressure are not associated with metabolic syndrome. Question 30. A patient with a history of hypothyroidism is prescribed levothyroxine. The nurse should instruct the patient to report which of the following symptoms, as it could indicate an overdose? A. Fatigue and weight gain. B. Increased appetite and heat intolerance. C. Dry skin and hair loss. D. Cold intolerance and constipation. Answer: B. Increased appetite and heat intolerance. Rationale: symptoms of levothyroxine overdose include increased appetite, heat intolerance, and signs of hyperthyroidism, such as tachycardia. Fatigue, weight gain, dry skin, and hair loss are more typical of hypothyroidism and would not indicate an overdose. Question 31. A 60-year-old male presents with a history of fatigue, weight loss, and excessive thirst. His blood glucose is 400 milligrams per deciliter, and his hemoglobin A1C is 9.8%. Which of the following complications is he most at risk for if his blood glucose remains uncontrolled? A. Diabetic nephropathy. B. Hypoglycemic coma. C. Thyroid storm. D. Diabetic ketoacidosis, DKA. Answer: A. Diabetic nephropathy. Rationale: chronic uncontrolled diabetes increases the risk of diabetic nephropathy, which can lead to kidney failure. Hypoglycemic coma is not a typical complication of uncontrolled diabetes. It's associated with insulin treatment. Thyroid storm is unrelated, and DKA is more common in type 1 diabetes. Question 32. A patient presents with severe muscle cramps, fatigue, and dizziness. Blood work shows elevated potassium levels, low sodium, and low aldosterone levels. What is the most likely diagnosis? A. Addison's disease. B. Hyperparathyroidism. C. Pheochromocytoma. D. Cushing syndrome. Answer: A. Addison's disease. Rationale: the combination of elevated potassium, low sodium, and low aldosterone levels is indicative of Addison's disease, which involves adrenal insufficiency. Hyperparathyroidism typically causes hypercalcemia. Pheochromocytoma involves catecholamine excess, and Cushing syndrome involves elevated cortisol. Question 33. A 45-year-old female with a history of obesity and hypertension is diagnosed with hypothyroidism. What would be the primary goal of treatment? A. To lower her cholesterol levels. B. To normalize her thyroid hormone levels. C. To manage her blood glucose levels. D. To reduce her blood pressure. Answer: B. To normalize her thyroid hormone levels. Rationale: the primary goal in treating hypothyroidism is to normalize thyroid hormone levels, typically through levothyroxine. While managing cholesterol, blood glucose, and blood pressure is important, they are secondary goals in this context. Question 34. A 30-year-old female with polycystic ovary syndrome, McQs, presents with elevated testosterone levels and irregular menstrual cycles. What is the most appropriate first-line treatment for her symptoms? A. Metformin. B. Spironolactone. C. Oral contraceptive pills. D. Insulin injections. Answer: C. Oral contraceptive pills. Rationale: oral contraceptives are the most commonly used first-line treatment for managing elevated testosterone levels, regulating menstrual cycles, and improving symptoms like acne and hirsutism in McQs. Metformin is used for insulin resistance, spironolactone for hirsutism, but oral contraceptives are typically the first-line choice. Question 35. A 38-year-old male with a history of hypertension and elevated serum creatinine presents with bilateral lower extremity edema, and his blood pressure is 160/95 millimeters of mercury. What is the most likely underlying cause of his condition? A. Diabetic nephropathy. B. Renal artery stenosis. C. Cushing syndrome. D. Primary hypoaldosteronism. Answer: B. Renal artery stenosis. Rationale: renal artery stenosis can lead to hypertension and renal impairment, which often causes bilateral edema. Diabetic nephropathy is more common in patients with diabetes. Cushing syndrome is associated with hypercortisolism, and hypoaldosteronism leads to sodium retention, but it's not the primary cause of bilateral edema and hypertension. Question 36. A patient with hypothyroidism is being treated with levothyroxine. During a follow-up visit, the nurse notes that the patient is experiencing increased anxiety, weight loss, and tachycardia. What should the nurse suspect? A. Levothyroxine overdose. B. Hypothyroid crisis. C. Adrenal insufficiency. D. Hyperthyroid storm. Answer: A. Levothyroxine overdose. Rationale: symptoms like anxiety, weight loss, and tachycardia in a patient taking levothyroxine suggest an overdose, which can cause hyperthyroid-like symptoms. Hypothyroid crisis, myxedema coma, and adrenal insufficiency are not typically associated with these symptoms, and hyperthyroid storm would require more severe symptoms like fever and confusion. Question 37. A 40-year-old female with a history of hyperthyroidism is being treated with methimazole. She reports a sore throat and fever. What is the most important intervention? A. Administer an antipyretic and monitor the temperature. B. Obtain a complete blood count, CBC, and hold the methimazole. C. Discontinue the methimazole and start corticosteroids. D. Administer a thyroid replacement hormone. Answer: B. Obtain a complete blood count, CBC, and hold the methimazole. Rationale: methimazole can cause agranulocytosis, which presents with symptoms like sore throat and fever. A CBC should be obtained to check for a low white blood cell count, and methimazole should be held until the results are reviewed. Antipyretics and corticosteroids are not appropriate without confirmation of infection or blood count abnormalities. Question 38. A 60-year-old female with a history of hypertension and osteoporosis presents with increased thirst, polyuria, and confusion. Her serum calcium level is elevated. What is the most likely diagnosis? A. Hyperparathyroidism. B. Addison's disease. C. Diabetes insipidus. D. Hyperthyroidism. Answer: A. Hyperparathyroidism. Rationale: hyperparathyroidism leads to elevated calcium levels, which can cause symptoms such as increased thirst, polyuria, and confusion. Addison's disease typically causes fatigue and hyperpigmentation. Diabetes insipidus causes excessive urination due to a lack of ADH, and hyperthyroidism causes weight loss and tachycardia. Question 39. A 28-year-old male presents with symptoms of dizziness, muscle weakness, and fatigue. His potassium levels are 6.5 milliequivalent per liter. Sodium is low, and his aldosterone levels are undetectable. What is the most likely diagnosis? A. Addison's disease. B. Cushing syndrome. C. Primary hyperparathyroidism. D. Hyperaldosteronism. Answer: A. Addison's disease. Rationale: Addison's disease involves adrenal insufficiency, which leads to low aldosterone levels, electrolyte imbalances, high potassium, low sodium, and symptoms such as dizziness and muscle weakness. Cushing syndrome involves elevated cortisol. Hyperparathyroidism involves elevated calcium, and hyperaldosteronism involves high aldosterone levels and hypertension. Question 40. A 65-year-old female with a history of hypertension, hyperlipidemia, and diabetes presents with persistent fatigue and unexplained weight loss. Her serum cortisol levels are elevated. What is the most likely diagnosis? A. Addison's disease. B. Cushing syndrome. C. Hyperthyroidism. D. Hypothyroidism. Answer: B. Cushing syndrome. Rationale: Cushing syndrome is characterized by elevated cortisol levels, leading to symptoms such as fatigue and weight loss, especially in patients with risk factors like hypertension, hyperlipidemia, and diabetes. Addison's disease involves low cortisol. Hyperthyroidism causes weight loss and tachycardia, and hypothyroidism causes weight gain and fatigue. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!